welcome everyone, and welcome Dr. Siddharth Sarma.
Thank you.
Dr. Siddharth Sarma, as we are here in Hotel Le Meridian, and we are here for Indian Medical Association Australia Queensland chapter India meeting, and it's a great privilege for us to have Dr. Siddharth Sarma, who is the secretary of the Indian Medical Association Queensland chapter. So, Dr. Siddharth, we would like to ask you about your journey, starting from India, how you started in India, now you're in Australia. So, tell us about yourself, like who you are, where you did your schooling, your education, your medical education, and how you travel now, your position in Australia. So, tell us about yourself.
Thank you, Dr. Kumar. It is a privilege here to be back in a country which I hold very dear to my heart, because I was mainly I have been born here. My father was actually a pediatrician. He's no longer here now with us. I was born in Assam, northeast India, and did my medical education from the Guwahati Medical College in Guwahati. After completing my internship, I did my PLAB exam, and it was a phase at that time. A lot of my friends, we wanted to go to England. And I went to England with the view that I would actually do pediatrics like my father, because he was a pediatrician. And I ended up in England and decided at that point in time that family medicine was my calling, because I was interested in the comprehensiveness of family medicine, which we will discuss a bit later on, and the service that it provided to people. So I trained in family medicine in the UK. I was a family medicine practitioner in the UK for a few years, and I owned businesses there of creating a business in family medicine. So during this time, I did my membership from the Royal College of General Practitioners in the UK, and I had a small family there, had my businesses there. But then I decided that, at that point in time, I wanted to look for fresh avenues. And Australia is a country which always fascinated me. So I just packed up my suitcases and I thought, well, let's just give it a go. So went to Australia, and then I got my fellowship in family medicine in Australia. And right now I've been working as a family physician, or a GP as we call it, in Australia for the last about 13 years now. I own 2 medical centers from which I practice medical general practice along with a few other GPs. Along with that, I have had a very strong role in advocacy in general practice. I have been a GP trainer. I also regularly examine students for examinations in general practice. I'm a member of the Clinical Council of the Australian Medical Association in Queensland as well. And as you just mentioned, I'm also the secretary of the Indian Medical Association. So quite a few roles, but the role that is the closest to me is the role of a general practitioner. So we have something called Medicare, which is funded by the federal government and also by the taxes that people pay. And that the whole aim of Medicare is to provide services at a community level, and to provide services to everyone who is an Australian citizen. Along with Medicare, we also have a very strong private hospital network. That someone who can't afford to have private insurance or go through a private hospital route can choose to go through a public route. So both of these systems complement each other and run parallelly. And that is a beautiful system. And the center of this is the general practitioner, because they have the gatekeeper role, without which this universal health system will collapse because they won't be able to afford it. So a huge proportion of medical problems are dealt with at the primary level.
So, as you know, India is one of the largest medical education system of the world, and we are currently producing more than 100,000 MBBS graduates a year. We have more than 7 medical schools, medical colleges across India. And large number of these medical graduates want to see and also want to know, explore what are the career options abroad. Like you yourself went through the peer route. Is the peer pressure, peer behavior that people want to go to US, UK, Australia. So, what is the pathway for Australian license?
Look, the Australian licensing is generally through the Australian Medical Council. There are several steps. Again, it depends on what level you are wanting to go there. Whether you want to go there as a general practitioner, in which case you apply to the Medical Council, you go through your International English Language Proficiency Exam, or the IELTS. Then you have to have your qualifications approved by the AMC through a process called the PESCI process. And then you apply for your AMC Part 1, Part 2. So there are different licensing exams that you have to go through. As a specialist, I was reading an article this morning that they have now started to fast track certain specialists into Australia. Just a period of supervised training. And if they consider your qualifications equivalent, you can come and work in Australia. There is a big interest in Australia in doctors from the Indian subcontinent because our skills are very highly valued. So I think if someone wants to go to Australia, either to work on a temporary or maybe later on as a permanent doctor, the first step is to contact the Australian Medical Council, or alternatively, if you are a specialist, contact your Royal College in Australia, and they would give you a detailed breakdown of the steps that you need to follow. Bearing in mind that regulations are changing quite fast, as you know about the H-1B visas in the US.
Right. So tell us, because you've also exposure to the UK system. So tell us about how the licensing system for international medical graduates work in UK.
The United Kingdom is, I think it's a bit more structured in the sense that, if you want to go to the UK, you generally take the PLAB exam. It has different steps. It's got, your theoretical skills. It's got your clinical skills. And then you go through what we call a foundation doctor program, after which you apply for different specialties. The difference, Dr. Kumar, between Australia and UK, having been there for both the systems, is that I feel personally, and I think a lot of my colleagues will agree with that as well, the UK has more of a nationalized system towards medical education, whereas Australia is still more state-based. So regulations might differ from state to state, but overall, I think it's quite equivalent, and training's excellent, obviously, in both countries.
Correct. And we all know about NHS,
National Health Service.
About NHS of UK.
Okay, the National Health Service, again, is a universal umbrella scheme, a bit like Ayushman Bharat, which has started now. Obviously, it was created during the World War to try and provide healthcare to the families of the people who left for the war. Absolutely 100%. It's a beautiful public health system, hands down. But and anyone who is a GP or a specialist who works for the national health system, they provide public health care. Because of the excellent public health system that we have in the UK, the private system is not that common. There is a downside to that as well. As I just said, in Australia, we run a public and a private parallelly. So the pressure on the public system is much lesser in Australia as compared to the UK. And there is a huge pressure on the public health system in the UK as a result of which, and we have seen cracks in the national health system as a result.
So great. It was great talking to you, Dr. Sharma, and thank you for sparing your time for us. And I hope that this conversation, when it is disseminated, will be useful for public policy makers, also students, professionals.